Good afternoon. Thank you for having us, Infection Controls. I think you'll find our talk very interesting. It might be a little different from the other talks that we've had here. But I think the application of software and wrapping all this together, I think it plays a vital role in the control of healthcare-associated infections, and that's what I want to get into. And I like starting with these headlines, and a lot of you probably have heard of these, right? Remember the flu season? Yes, technically we're still in it, but it's one of the worst flu seasons in the last decade, this H3N2 that was going around. People were really concerned about that. And just recently, the CDC just released a report that looked at bacteria that they tested in patients they collected throughout the year 2017. And what they found, which is I find very interesting as a microbiologist by trade, is that 1 out of every 4 bacteria had some resistant antibiotic gene associated with them, which is really scary if you think about it, where we're coming to a time where bacteria are becoming resistant to really all antibiotics. And so this is where I present the problem. We've all heard of healthcare-associated infections. You might have known somebody or maybe been a patient that you go to the hospital, you pick up something else while you were there. It is very common, more than you think. 1 out of every 25 patients that are admitted to a hospital will develop some type of hospital-associated infection. And there's some numbers here that kind of breaks it down into how many cases, about 750,000 here. We're looking at about 75,000 deaths, and we have numbers about $10 billion in costs. Now, these are 2012 numbers. Most likely, these are underrepresented in what's the true cost of these healthcare-associated infections. And so the next question is, okay, why do we see this problem in healthcare? Where is it coming from? Well, if I asked a group of infection professionals, doctors, nurses, 30 years ago, and I say, where do people get sick from in the hospital? Well, the answer would probably be, oh, you get it from yourself. You're colonized, and so you infect yourself. Well, part of that is true, but there's actually a scientist, kind of father of environmental disinfection, Dr. Weinstein, here back in 1991, made this statement, which still holds true today, by the way, is about half of cases can be endogenous microflora. What that means, you're colonized with some bacteria, you could show symptoms or be asymptomatic, and you could potentially pass that on to yourself. But what we're finding is that these colonized people can pass on those organisms to healthcare professionals' hands and eventually into the environment. So about half of the cases of hospital-acquired or hospital-associated infections are from some type of environmental contact or contact with contaminated hands. And I have some studies here that I find very interesting that looks at, okay, how contaminated are the hands of healthcare personnel? And the first I looked at, VRE, VRE is a vancomycin-resistant intercocci. And when we look at VRE, what we find is that when a nurse would go into the room and do their normal thing for treatment, swab their hands when they came out, 52% of them had VRE on their hand. They picked it up somewhere in the environment. And what's neat about these studies that I have up here, it was only looking at contact with the environment, not contact with the patients here. And then you've probably heard of MRSA before, methicillin-resistant Staphylococcus aureus. 45% of healthcare workers picked it up when they were treating a patient with this. And then, of course, the number one bad bug that we hear from the CDC is Clostridium difficile. About half of the healthcare professionals picked up the C. diff spore when they went to treat their patients. And so we know the hands of a healthcare worker can transmit these organisms in the environment. But what else plays a role in this? And another interesting study, or interesting studies, I should say, looks at, okay, what is your increased risk when you occupy a room that was previously occupied by someone with a multi-drug resistant organism? And so there was a couple studies that looked at this. What is your increased risk? It's kind of surprising. If you go here and look at MRSA at the top, you're probably about 40 or 50% increased acquisition rate or risk here. VRE, you're a little bit over 120 or so. C. diff, a little bit over 100%. Pseudomonas, an opportunistic pathogen that we find, is close to 100%, and then Acinetobacter is another common one. We see up to 300% increased risk. Kind of scary to think about, that you would think that before you entered that room, somebody must have cleaned and disinfected it to kill this. Well, there was a study that looked at this. And this is the most established study that looked at over 110,000 different objects across different hospitals, across different areas of the hospitals, and they actually assessed how well does EVS do in cleaning rooms. And so they broke it down to terminal clean, which is when the person's discharged. Typically you have more time when this is done. And if you see that on the left there on the red, is yes, they had a higher result here in terms of thoroughness and cleaning. On the right, you see the little green bars here. That was actually daily cleaning. But the number that jumps out at me is the overall average of thoroughness of cleanliness for EVS staff is 42%. Less than half of the rooms are clean and disinfected. Kind of scary to think about that we do have this problem. One of the reasons for this is the survival rate of these pathogens that we find in the environment. And probably the biggest thing that we see with pathogens in an environment in a real-world setting is this term called biofilms. And biofilms, if you want to think about it, kind of give you a visual, is when bacteria grow on a surface, they actually form a protectant layer over them, like a shell, that protects them from environmental conditions, can actually protect them from disinfectants in the environment. And what we see underneath that shell is exchange of genetic material. And this is becoming rampant, is where a bacteria with a resistant gene can pass that gene on to another species underneath that biofilm. And so if you look at the longevity of some of these organisms, C. diff. Now, C. diff is a little different, is that it forms what we call an endospore. This spore is highly resistant to most disinfectants, and studies have shown it could live up to years in a room, in an environment. And you look at some of the other ones, VRE, MRSA, you're looking at weeks here. Acinetobacter, weeks to months. Klebsiella, it's days. I put Klebsiella up here because this is a big one in terms of antibiotic resistance, and some of you might have heard the term CRE, carbapenem-resistant Enterobacter ca. This is one of the most deadly bacteria infections you could potentially have. You use last resort antibiotic, typically it's colistin, which right now has a 50% survival rate if you get CR. Go ahead.
I'm sorry. Are these like the exception and everything else dies within 24 hours?
Now, their organisms will survive for a different time, but typically for bacteria, you'll have days to weeks on these. And so what I'm really focusing on are the common healthcare-associated pathogens that we see in environmental settings that have confirmed antibiotic resistance. But in general, this is the common theme here. Viruses maybe not as long, like the flu virus or so, typically about 24 hours, and then it's not going to be active anymore. So we see we have a problem. Isn't it kind of scary? Do you want to go to the hospital now? No, exactly. And so what do? Well, there's been studies that look at, okay, let's intervene and let's train EVS staff, give them better tools, and to see if we can increase this cleaning thoroughness. Well, they did that, and they saw bumps up to 60 to 80% thoroughness. But what happens is, as you know, EVS staff, if you look at the pay scale, where are they? They're at the bottom of the pay scale. In terms of education level, bottom. And the turnover rate, very, very high. And so what ends up happening is that these numbers eventually drop back down to under 50%. And what do we do about it? And Dr. Weinstein, I quote him again. I love this. This is back in 1998, so 20 years ago he made this statement. Given the choice of improving technology or improving human behavior, technology is the better choice. And so that's what I want to talk with you here. And this is what I want to get into, what infection controls does, GERMBLAST, as our business name is. And let's utilize technology to the best of our ability, and let's help out the CVS staff. Let's help out hospitals, and let's see if we can do something about the spread of diseases that we're seeing in the hospital setting. And so what I want to go into is our multifaceted approach. And there's 4 what we call pillars that we stand on as a company. And so we have our main, what we call Germ Blast. That's our environmental disinfection. Talk about some of the technologies there. And we do use technology in our germ stats pillar, analyzing environmental data, putting this into software that's easy accessible for our clients. We let the software do all the stats, and so it alleviates all the problems with that and gives our the end result something that's usable, good for making decisions. And then, of course, training, education is very, very important with our clients. The healthcare environment, of course, is always evolving. Same true as microorganisms. And so we got to make sure we have best practices. We're keeping everybody up to date. And so we can do this through different webinars, webcasts, podcasts for our staff. And then our last pillar that we stand on is making sure everybody's aware, okay? Understanding how diseases are transmitted, what we can do to limit that transmission. So let's talk about the environment. And when I look at controlling microorganisms in the environment, how do you kill this? And I would say this is a technology. It really is. It's called microfiber. Some of you might have heard of this before, but I love microfiber. In my opinion, it's one of the most important steps in the overall disinfection process. And the reason for this is the microfiber is designed to help break down those biofilms that I talked about. It also is very good at removing what we call organic matter and even microorganisms from a surface. And I have a picture here to show you microfiber versus a good old cotton cloth. And what's neat about the microfiber, if you blow up what one fiber looks like, you see all those indentations on there? And so when you rub that fiber across the surface, it can grab and hold that bioburden, as we call it. And studies have shown that we could actually get a 93% removal of bioburden using a wet microfiber, just by physical removal alone. If you look at the cotton fiber, what do you see? Is once that fiber saturated, you're just spreading everything. Okay? And so microfiber is very, very important. And a lot of the microfibers now, we can actually impregnate them with copper ions and silver ions, which is another neat technology I won't spend a lot of time on, that actually has antimicrobial properties. But if you look at microfiber, and like I said, I think it's the most important step in the overall disinfection process, is it's really tough to replace this. I mean, it's good old elbow grease, getting in there and scrubbing the room. And so right now, I still don't see any way around it yet, but we still have to do it. And so what do we scrub? And if you talk about EVS, I mean, how much time do they have in rooms? Not much, do they, for turnover? You got to talk about turnover, okay? And so one thing that we do teach our EVS staff is let's focus on what we call critical touch points. And so in other words, how are you going to get sick? And there's different ways you can approach this. I really boil it down to two ways. One method of contracting an illness is if somebody has the flu and they sneeze in your face, right? And we have this direct person-to-person contact. So it might be a little bit harder to control, maybe teach people sneezing etiquette, right? But the second method, let's say that person sneezes into their hands and they touch a doorknob. And then you come on behind them and you touch that same doorknob and you just eat lunch, rub your nose, whatever, and voila, you could potentially pick up that microorganism. And so what we really like to focus on, okay, where are you going to pick up something in the environment? What are you going to touch? And so if you can really focus on those high touch point areas, you can really reduce the spread of infection. And so we've done studies on looking at, okay, how contaminated are these areas? And so you can go to your bed rails, your nursing stations, okay, kind of your classic contaminated items. But I'll put some uncommon items up there that a lot of people don't think about, okay? And you might think about this in your everyday life as well. Dispensers. Now, granted, nowadays we're moving to everything is automated, so you don't have to touch any dispensers. But does any of you at work have a soap dispenser that you have to touch? What about a hand sanitizer dispenser that you have to touch? What we find is those are one of the most contaminated areas because people just don't think about it and cleaning it. And I love my favorite one here, Kleenex box. Has anyone of you ever disinfected a Kleenex box? Probably not, but if you think about it, if somebody's sick, rub their nose and they do what? Touch the Kleenex box and pull the Kleenex, okay? And so the key thing is that I really like to focus on is, okay, let's focus on these touch point areas, the spread of disease. But when we talk about EVS staff, I mean, they are limited in what they can do. I mean, they can go through, they can wipe things down, apply the disinfectant, and that's about all they can do. And so this is where technology can come into play. And there's a lot of cool stuff out there, and that I get the opportunity to play with and test and research, and we even develop at Germ Blast different methods to maximize the effectiveness of killing microorganisms in the environment. And so let me just talk about a few briefly. Some of these you might have heard of before. You might have heard of UV light, the little robots, UV robots. Anybody use one at the hospital? Okay. And so that's a very popular one. You got continuous, you got whole room UV robots that you can use. There's even a type of UV lights that are targeted that we've done some research on, where there's some articulating arms that you can move and position and put the UV light on certain areas in a room. There's even UV lights for your iPhone and iPad. Because as you know, do you want to use some liquid disinfectant on your iPhone? What happens? It voids the warranty, right? And so what do? You're limited. There's actually these little portable UV devices where you can throw your iPhone in their iPad and it will disinfect it. So UV light is an effective method, but it's not the only method out there. And of course, chemicals. That's probably the most common one that we see. Is there's numerous chemicals out there. Chemicals have different costs. They have different toxicities. Some leave a residue. Others don't. Typically, as a company, we try to go to the side of less toxicity, but still keeping efficacy with a chemical, biodegradable chemicals that are good for the environment. And what we've actually found in our research is that applying the chemical plays a big role. And using a machine, as you can see here, the green machine with a little handle, okay? This is called an electrostatic sprayer. And what's neat about this sprayer is that when it sprays the chemical, it actually charges it, and it makes it attractive. And what's cool about this technology is when you spray, like say you spray it on a door handle, right, is, well, if you just use a good old spray bottle, it just covers the front of it. But if you use an electrostatic sprayer, you actually get wraparound effect. And so you can actually get better coverage of those areas. And so this is what we found in the research is a good method of applying chemicals in the environment, and actually a very quick method. Another thing is when you talk about chemicals, technically they're regulated by the pesticide branch, okay, of the government, and they can be toxic. And so there's actually a technology out there using dry mist steam. I've seen them for homes. What you do is just water is the only chemical, and you can heat that water to high pressures, and you can get very, very high temperatures of that water, and you can actually disinfect an environment very well. And so we use this in areas that are moisture resistant. You can talk about showers, bathrooms, commodes. Very good job at cleaning those areas. Another one that I find interesting is the aerosolized hydrogen peroxide. It's another kind of like a robot. You can put it into a room, and then what it does, you close off that room and it spews aerosolized hydrogen peroxide. And what's neat about it, it covers that room. Okay? It kind of takes this from the pesticide. Remember the bombs? You remember you would go in your house, and of course you couldn't enter your house for what, 24 hours or something like that. But this one is using hydrogen peroxide, which in my opinion is one of the safest chemicals on the market in terms of biodegradability. Don't have any residue that's behind that could be toxic to people. But this guy does wonders at going through and just disinfecting a whole room. Okay? So I went through and I mentioned a couple of the different technologies that we see out there to aid in the disinfection process. But one thing about the disinfection process is once you disinfect with a chemical, with UV light, with steam, is once a person comes back into that room and touches that surface, what happens now? It's recontaminated. And so what do you do about that? Well, there is actually a chemical out there. It's called a biostatic polymer. And what's neat about this polymer, you can apply it electrostatically like we do the chemicals, but what it does, it forms a protectant layer on the surface. And what the studies have shown is that this protectant layer inhibits this bioburden from forming, these biofilms from forming in the environment. And it can actually inhibit the growth of certain bacteria and certain fungi and mold in the environment. And so what's neat about this polymer, it gives you some long-lasting effect after the disinfectant wears off. But we've talked about surfaces, disinfecting surfaces, and one thing, in my opinion, that I think is really lacking is what about the air we breathe? What are we doing to decontaminate the air? Well, you can put a HEPA filter, probably have that in your house. You can get a HEPA filter with a UVC light. You've heard of that before. But there is a neat technology that NASA developed for the International Space Station, because if you think about it, up there, they're rebreathing the air. And what this technology entails is called photocatalytic oxidation. It actually uses UV light to generate a reactive oxygen species that pretty much breaks down anything that comes in contact with it. It's really neat. It breaks down contaminants, it breaks down volatile organic compounds, and it's been shown to break down microorganisms, bacteria, anthrax spores. There's been studies that have shown that knocking that out of the air. And so the main thing I just kind of want to give you a feel for is that using innovation, using technology, and what we do with this is we just don't rely on one of these steps. Sometimes we use all of these steps, sometimes we use 4 of these steps. But the goal is to go into an environment and provide a high level of disinfection to aid those environmental service technicians, which are hopefully getting half the environment disinfected, but us coming through, we can actually get that number significantly higher. All right, so that's our first pillar, looking at our disinfection process. But the next question is, okay, how do you analyze that environment to make sure the disinfection process is actually working? And this is where we get into our next step, our germ stats, our second pillar of the company. And I have here is something called ATP. Some of you, if you had some science classes, remember ATP, adenosine triphosphate, is the energy molecule of life. And what's neat about this technology, it actually gives us a means of assessing what we call bioburden, or organic matter, or how dirty a surface is in the environment. But what I love about this technology is that I remember old school days when I had to go in the environment with a swab the environment, swab a petri dish, wait 24 to 48 hours for it to grow, and then count everything. With this guy, you can get results in less than 30 seconds. And what's cool about it is it uses an enzyme that you find in fireflies or lightning bugs that light up. It's called luciferase. And the idea behind this is if there's a lot of organic matter, okay, be dead bacteria, live bacteria, doesn't matter, is there's ATP present. And the more ATP that's present, the more light that's released. And you can stick it into one of these machines, it's called a luminometer, and it actually quantifies the amount of light that's produced. And so this actually gives you a very rapid tool to quickly assess the environment to see, okay, is this surface relatively clean or is it dirty? Secondly with this is you can actually take that data, put it into the software, and do a lot of different things with it. And I did some examples here. One is looking at a room. Let's say we have EVS staff go into a room and we want to analyze and see how well they did and do it very quickly. And so you can go through and you can swab with that ATP swab and look at, okay, what are those values? And so you can do a telephone, you can do a tray table, call button. From our research, what we found, and by the way, we've collected over, we're close to 50,000 ATP samples that we've collected over the years, and we've done numerous tests to kind of say, okay, what is kind of the standard? What is considered acceptable in this relative light unit, this number that we get on the ATP meter? And what we found is about 200. And so you kind of see the 250 there. So a little bit underneath that is considered acceptable. Remember, you're not going to sterilize the environment, okay? What you want to do is you want to lower the microbial load to an acceptable level. And that's what we're looking at here. And so in this example, what do you see? It looks like the tray table and the call button were a little high. And so what's going on? Did the UVS staff miss it? Are we seeing a problem with just education on that one? And so this is the type of data that we can get in terms of assessment from just a room. Then you can actually take that data and you can start to plot it and start to develop a trend and see how things are going over time. And I love this part, is that this actually kind of gives you maybe an early detection system. Okay, is there something going on that we can nip in the bud before it gets worse? And there's a lot of things that you can derive from this data. And if you notice here in the September 2017, you see a little spike. So what happened? Right? Was somebody not using the disinfectant properly? Or was there a change in personnel? What's going on? So, or do they just need some education? And so that kind of gives you an opportunity to say, hey, let's reassess, let's make sure we're doing things properly. We did have this high number and make sure we're kind of keeping underneath this level. And so I love ATP compared to old school methods, and it does give us some valuable information. And this is just one example of our software. We have other software setups where we can barcode equipment to verify that it's been disinfected. You can have different types of setups where we can program a specific type of room, make sure it's disinfected properly. For example, Clostridium difficile, that requires a different disinfection process than a normal room. And so we have software that can track that. And it plays a big part in making sure we are nipping some of these potential outbreaks in the bud. All right, so that's the second pillar. Let's look at our third pillar here, our Germ Blast University, and get into, okay, education. We know that's important, educating our employees, educating EVS, educating nurses, IPs. I put up here hand hygiene. As I mentioned earlier, healthcare professionals' hands can pick up these multi-drug resistant organisms in the environment. So going through and talking about hand hygiene, talking about compliance, talking about acceptable CDC recommendations on washing your hands. There was a study done a couple of years ago that looked at nurses and looked at, okay, how effective, okay, in other words, are they following the proper procedure when they do their hand washing? And you know what they found in terms of the number of nurses actually washing their hands correctly? Is it 100%? No. 35% of nurses washing their hands correctly. That means, you know, singing the happy birthday song twice and scrubbing, all right? Okay? What do you think about the general population? Not 35%, right? It's going to be probably, what, single digits maybe on that? Okay? And so, yes, hand hygiene plays a huge role in this. Proper chemical usage. Probably the biggest thing with chemical usage is when you spray a chemical on the surface or apply a chemical on the surface, it has to set. It's what we call a contact time or dwell time. It takes time to kill those microorganisms. And most people, you know how they disinfect? You spray and wipe. Well, you might be removing something, but you're really not doing much. You got to spray that chemical and you got to let it set. Does anybody know how long you got to let it set? Have you ever looked at a product label? I guess that's my job. I guess 10 minutes. Yes, most disinfectants, hospital-grade disinfectants, have to set for 10 minutes. Right? And that's key. Some you can get down to 5 minutes with wipes. Those are disposable. You can get a little bit faster on that, but still, it has to sit there. And they need to know that. Joint Commission will come in and quiz EVS staff if they know the contact or dwell time. So that's important. Going on, antimicrobial stewardship. This is key. I mean, it's really why we're at this problem right now, why we're seeing bacteria resistant to antibiotics. And it really goes back, you know, to the 60s and 70s, probably when most of us were kids, is when you went to the doctor, what'd you get? You got some type of antibiotic, right? Even if you had a flu, which is a virus, by the way, and antibiotics don't do squat against the flu virus. And so we were prescribing antibiotics like crazy, like candy, pretty much. And then people would take the antibiotics for 3 or 4 days, and then they feel good, and say, oh, I'm going to save that until a little bit later. And most dosage, you had to take it for 10 days. And so what has happened throughout the years is because of overprescription of antibiotics and not taking the full dosage of antibiotics, is we're starting to see this resistance come to play. And it's kind of scary when I look at it as a microbiologist. And if we look at the pipeline of potential antibiotics that's coming down the line, there's very, very few. It gets scary to think about that someday, I mean, pretty much we are here, is that there's bacteria that's resistant to all antibiotics out there. And so that's key that we make sure we're killing those in the environment. And then I put the chain of infection. Just kind of give a feel for how our disease is transmitted and making sure our clients are educated in this. But education definitely plays a key role in helping prevent the spread of infection. And lastly, on our last pillar here with our awareness, is everybody needs to be involved in this, from EVS staff all the way up to upper administration when we talk about controlling the spread of microorganisms. We can even go out into the community. I think the community needs to be aware about the spread of microorganisms. And I've seen more and more pamphlets on looking at, okay, if you have the flu virus, you need to understand that antibiotics will not work. Educating the public on that and trying to get more into this antimicrobial stewardship. But as a company of Germ Blast, our motto is keep the fight outside of the body. If you think about it, we have a lot more weapons at our disposal to kill the microorganisms in the environment, but once somebody gets infected, we're really limited in what we can do. And so really the key is going into the environment, making sure we're doing the disinfectants properly, using all the technology, all our resources that we have, making sure we're doing a good job, educating our clients about this, and hopefully, we start to see a decrease in these hospital-associated infections.